This is Dr. Martin Leland, and I'll be demonstrating my arthroscopic subscapularis repair technique. Some orientation. This is the left shoulder from the posterior viewing portal. You can see the biceps, the subscapularis, and the humeral head. First step is to create an anterior portal. I like to create my anterior portal a little bit more medial than I typically would so that I can aim laterally getting into the joint and really get perpendicular to the humeral head at the insertion of the subscap. Here the portal's created, and I'm taking a shaver, debriding the superior subscapularis tearing as well as the footprint, as you can see here. I debride the subscapularis down to healthy bleeding tissue, as you can see. It's hard to use the shaver because you can't use the very tip of the shaver in order to debride the footprint of the subscapularis. So I like to switch to a burr, which I run in reverse. And using that, I can really debride the soft tissue over the footprint of the subscapularis down to a nice healthy bleeding bone bed without decorticating it. I impact my all suture anchor in the center of the footprint of the subscapularis. And then I take a bird beak and I use that to bring my sutures medially, so they're basically going to be right in front of where I pierce through the subscap for the repair. I like to pierce through the subscap in the healthy portion of the subscapularis tendon, and here I'm pulling out the first of the suture limbs, pulling it through the subscapularis. I then repeat this again with the second limb of the sutures, which I did already, and now I'm going to be passing it through for my third pass. I basically pass all of the sutures in a horizontal mattress configuration through the subscapularis. Here is grabbing the third limb of suture, and then I'm going to be repeating it again for the fourth limb. Once all of these sutures are passed through the subscapularis in the horizontal mattress configuration, I actually pull my anterior cannula out and then reinsert it. That way I don't have any suture limbs coming through the cannula. I can now grasp them one pair at a time. So first grabbing the two inferior sutures, pulling it through the cannula, and then tying them down. As I tie down the sutures, you can see the subscapularis is pulled laterally as well as compressed against the footprint. Once the inferior limbs are tied, I cut them and then grab the superior suture limbs and tie them down, again showing that the subscapularis is pulled laterally and compressed against the footprint. Here I'm tying my half hitches to back up my sliding locking knot. Once it's completed, I then put the shoulder through internal and external rotation, showing a very solid fixation to the footprint. With a closer view, you can see the healthy subscapularis tendon that's coming right to the footprint with an excellent fixation down right to the subscapularis footprint. Just to review, here's the subscapularis prior to repair and after repair. Thank you very much.